our mission is really that all women across the world can have easy and equitable access to evidence-based knowledge and health care. We want to empower the women and the healthcare provider because everyone entering menopause has to do choices. They are really informed. It's important, that the International Menopause Society is a true international society. Why? Because nowadays we have 71 affiliated menopause society. They are together into the Council of Affiliated Menopause Societies that we name NAMS. And we have members from more than 90 countries. And this is great because this is really to be truly international. The World Menopause Day is October 18 every year. And the theme of this 2026 is chronic pain at midlife. And there are so many women out there. For them, pain is under-recognized, under-diagnosed, and under-treated. And this is the reason why we decided to focus on this topic for the World Menopause Day. It's very important, that International Menopause Society has the aim to develop, for example, recommendation, guideline, position paper. And this is the reason why we partner with some society working in the field of hormones and reproductive medicine. For example, we partner with the European Society of Human Reproduction and Embryology, ESHRE. We partner with the International Federation of Obstetric and Gynecology to produce documents or to have partnership symposia in order to share ideas on the most common condition associated with midlife, health, and menopause. This year also, during my term as president, we decided to partner societies in other areas of medicine. For example, the International Sleep Society, the International Headache Federation, the Fragility Fracture Network, and other societies in the field of urogynecology or vulvovaginal disease. It's really crucial for us to share ideas between people that deal every day with menopausal women that can have other medical conditions with healthcare provider. They see women, different stages of their life, but they are able to understand how reproductive milestones may influence the course of some condition and diseases. Because only with this partnership, we can better serve women's health. Following the last release of the guideline 10 years ago, this year we had the new recommendation. We put together 38 experts that cover 30 sections of clinical practice at midlife and for menopausal health. And we really produce evidence-based menopause care freely accessible for everybody. And this is on the website of the International Menopause Society and is published in our journal Climateric, and everybody can download for free. Because you have to remember that menopause, yes, it's a biological event that it's in every woman. If you live in the US or if you live in Africa or East Asia or in Europe. But there are many different geographical variation, prevalence of disease and condition, symptoms, severity, according to the psychosocial environment and also the healthcare system, because in some countries it's so difficult, for example, to have access to a wide range of hormonal options. And so we really need to produce guidelines that can fit many different parts of the world. We touch a wide range of health topics, almost every topic, from lifestyle medicine, what you should do in terms of self-care and lifestyle to protect your body and mind at the menopause. And we study a lot and we focus a lot on body changes, body image, weight gain. That is a very important issue for women all over the world. And then the cardinal symptoms of the menopause, how you diagnose, how you manage vasomotor symptoms, genitourinary syndrome of menopause, osteoporosis, cardiometabolic health, cognitive impairment, and even dementia. And another very important topic that is premature ovarian insufficiency. And then we produce also recommendations, for example, for women. They are high risk when they counsel the menopause expert because they have contraindication, for example, to menopause hormone use, absolute contraindications such as breast cancer or other estrogen-dependent condition, or relative contraindication in which you see you have to do a proper balance of benefit and risk, and you really need to handle with care. And then we introduce also some new hot subject, for example, sarcopenia. You know, sarcopenia, it's really a hot topic because of the longevity across the world that has significantly increased. And we know how this dimension of women's health has been overlooked, but is extremely crucial. As you can imagine, the topic of chronic pain, it's really huge because we have so many chronic pain conditions in general in human beings and in particular in women. But we decided to give an overview of the current evidence that we have on the most common, first of all, fibromyalgia and musculoskeletal syndrome of menopause, migraine, headache in general, and chronic pelvic pain. These chronic pain syndromes, they are relevant because they are giving so much disability to women and they can impair quality of life. So we decided to really make an update, a synthesis of chronic pain in menopausal women in order to let healthcare providers, but also women, know about the most relevant neurobiological mechanisms and how you diagnose, how you clinically manage, and how culture and lifestyle is important. Don't forget, a white paper is also a call to action. You really need to be proactive because we have to guide women in that multidisciplinary way I hope for women health. It's not only the OBGYN, it's not only the endocrinologist, it's a team of healthcare providers that can help women. I have to tell you honestly that I met so many good, professional and highly qualified people at Taylor and Francis. And our journal, Climateric, is in very good health thanks to the work of a great team. Not only our editor-in-chief, Professor Tim Inland from the UK, but all the people that help us to revise paper, publish them in a fast way. Thanks to this fantastic team at work, we really increase our impact factor. Now we are around 4, and for us this is very important because we are in the first quartile and we are among the first 20 top journal in obstetric and gynecology.